Today we're in downtown Royal Oak answering questions about eyes. Want to ask me any questions about eyes?
No, thank you.
Alrighty. Want to ask me a question about eyes?
I'm alright.
Alright, thank you. I've never felt rejection before.
Wow. Never?
Never.
Is it true that people with lighter colored eyes are more sensitive to light?
That is generally true.
My goodness.
Yeah.
Incredible.
Is that you?
Yeah, I'm sensitive to light, and I also can't really see in the dark very well, so I feel like I got the worst of both worlds, you know?
Lighter colored eyes have a lot less pigment to absorb the stray light.
It's
so
messed up, honestly.
You gotta get some good sunglasses.
I do have some good ones. Not currently on me, but
That's okay.
yeah, I'll get to them soon.
Can you name 3 countries that start with the letter I?
Let's start with the letter I.
Yes.
Iraq, Iran, India. There we go.
Is it actually possible to change eye color?
Naturally, no.
Okay.
Naturally, no. There are people that have tattooing done on their sclera, that's the white color, or the white part of their eye, to change the eye color, or they'll ink their cornea, which is the very, very front part of the eye, so it'll appear it's different, but no, there's no way to naturally change your eye color.
I'm 49 years old, and I recently had to get prescription glasses for reading,
Okay.
but it's been like 2 years since I've got an eye exam,
Okay.
and I typically don't wear them
Sure.
like I should.
Okay.
So I guess my question is, should I go get an eye exam? Do I need to get maybe looked at again or something? I don't know.
I would encourage yearly eye exams for sure. Okay.
Yearly.
Even if you are not noticing changes in your vision, there could be changes going on inside the eye that you may not know about. As far as reading glasses, pretty normal. Usually when we get to our 40s, that focusing system starts to go down. And
I used to think there was something wrong with my cell phone, so I started like,
yeah,
now I always
pulling
got to
things
put the
further out.
brightness all the way up to see, but
For sure. Normal, and you're not harming yourself by not wearing them. It just could cause more strain,
that
fatigue
was
on the
next
eyes.
question.
I would recommend getting in just for a routine check. Even if nothing's changed, it's good to know that internal health is still good.
Okay. Well, I appreciate the information.
I appreciate you asking. Thank you. Have a good day.
What do you know about astigmatism?
Astigmatism is coming from your cornea. It's the very front part of your eye, and that is the shape of the cornea. So if you think about astigmatism as like a football, you've got a different curve going front to back, side to side. It's not the same curvature around. If you were to think of a basketball, that would have no astigmatism. It's perfectly curved or spherical. So if you have a lot of astigmatism, it can cause blur vision. It can cause lights to have a lot of strings on them. Nighttime driving, people find most difficult.
If I wear readers and they're 2.5s, do I need prescription glasses if I can't see when I read, or just readers?
So readers are generally fine. Do you see good in your distance?
Sometimes yes, sometimes it gets a little foggy.
Okay. A lot of people usually around age 40, could be sooner or later, we lose that natural focusing ability. So that's when those readers start. So 2.5 readers are fine to use. They're not harming your eyes, but you may benefit from prescription glasses that might be a little bit more specialized for your eyes. I say that because readers, it's the same powered lens on both sides. Sometimes a person has a little bit of a different prescription between the two. But
Interesting.
generally speaking, I mean, if they're doing a good job for you, that's totally fine.
Okay, thank you.
What color are my eyes?
Your eyes are beautiful brown. Do you have a question?
Do I have contacts on?
Yes.
Good job.
Thank you.
Next doctor.
So basically, I have this condition called lattice.
Oh, lattice.
I do have that. It's like they said
Yes.
it's like a tear in the retina or something.
It's not necessarily a tear, but it's a thinning of the peripheral retina. It does put you a little bit higher risk for retinal holes and tears.
That's what she
But
told
you
me.
can see, it's commonly with nearsighted people.
Yeah,
so
that's
you
what
can
I
tell
am.
your glasses are nearsighted
Yeah.
there. He has good eyes. He just needs to wear some glasses
For the
make him
rest of
see
his
it.
life. Yeah.
My grandma, she just had surgery for not LASIK, but the astigmatism, and you can like see the lens like in her eye sometimes.
She probably had cataract surgery. Yeah.
that.
Yep. But
Why?
you can fix it. So everybody has a natural human lens, and eventually that clouds over. That's termed a cataract.
Gotcha.
But you can fix cataracts. You can have astigmatism, and at the time of cataract surgery, you can fix astigmatism as well with the specialized implant.
And they just like put like an actual lens inside your eye, like what? Like
So behind your iris, the color part of your eye
Uh-huh.
is where the lens is located. So yeah, there's a small incision made. It's like 2 millimeters. They go in there. Your pupil's dilated. They take out your old lens, pop in a new one, it goes in like a burrito, unfolds, and that's it. 10-minute surgery.
That's crazy.
Yeah.
And you don't have like, it's not sore or anything after, is it? Or
You can be just a little like for body sensation because you do have a cut made to your eye.
Don't
but
you have to wear like a little thing on there?
We typically at our office will have them wear a shield at nighttime for like the first 5 nights, but during the daytime, no, they don't have to wear it.
Oh, really?
And sometimes we don't have to even use eye drops afterwards. We can inject the medication in their eye.
That's crazy.
That is crazy.
You almost want to sign up for cataracts.
No, I was like, wait.
If that wind took it.
What's your opinion on LASIK?
So it is a good surgery for the right patient, but you need to be screened. Make sure you have enough corneal thickness. If you don't have enough corneal thickness, if you laser too much, it's going to create issues. If you have significant dry eye going into the surgery, LASIK surgery doesn't make it any better. Also, if you're like over, like say, 55 to 60 years old, potentially cataracts are starting to form. It's not the great answer. You may want to do like an earlier cataract surgery or what's called a clear lens extraction. So it is a good treatment for the correct patient as long as they're screened.
Okay. If I'm a surgeon, I operate under very bright light. Is that bad for vision?
What kind of light are you looking at?
Like, the big headlights, so we wear another headlight.
So like the overhead lights?
The overhead lights with another additional headlight. It's so bright. I wouldn't wonder that. Is it bad for your eyes?
In general, I'm going to say no.
Okay,
your eyes are a very resilient structure, but as long as it's not UV and you're staring at like a laser beam sort of thing, that's going to be a very focal light to your macula, you should be fine.
Awesome.
How much is LASIK surgery?
Actually, at our office, it's $1,882, and that's for any refractive surgery. So PRK, LASIK surgery.
I said, what is the difference between PRK and LASIK?
It's actually a really good question. So LASIK surgery, the surgeon is going to create what's called a flap. So your cornea, they're going to lift this flap, lasers applied, that flap is put back down. It's almost like a human bandage over the eye. Some patients, due to whether their occupation, let's say a Detroit football player, they don't want to get poked in the eye, they don't want to deal with that flap, or they don't have enough corneal tissue. We do what's called PRK. PRK removes the skin of the cornea, the laser is applied right back down, we put a bandage contact lens on the eye, and all the skin peels back over. Ultimately about the same result, but it's a little bit longer healing process, but it's for the right patient.
I got you.
Hey guys.
Hi.
Any questions about eyeballs, glasses, surgery, sports teams, Tigers? Who's gonna win the Super Bowl?
So when light goes through the eyes, where does it land for you to be nearsighted?
In front of the retina. So so your glasses are pushing the light rays further back.
Okay.
If it's behind the retina, it's farsighted. If you have 2 focal points, it's astigmatism.
Okay, so if you're farsighted, it goes where?
If you're farsighted, it'll land behind the retina.
Okay, and in front is if you're nearsighted.
Yes.
Wait, I have a question. Is it dumb? But when people be blind, like, and their eyes be like green and stuff, like why does that happen? Like, I don't know if that's dumb, but
no, it's not dumb. There's not a lot of people that are 100% blind, meaning that they can't see anything. It's all is like no vision. But some people have like a bad cornea. They had a bad infection, and you'll see that their cornea becomes very opaque, and that's probably what you're talking about. And then, yes, they have very limited sight.
Oh, thank you so much.
You're welcome.
So there's like different names for blindness, like pinhole vision and stuff like that?
Well, there's different things. Like glaucoma causes a different level of blindness than macular degeneration versus like trauma, like a cornea that's very opaque. You can get an infection to your eye, like you had a corneal ulcer. That'll cause problems. Cataracts alone can cause blindness, but that can be fixed at least.
Okay, yeah.
So
that's
all. Things.
Well, thank you so much.
Just keep getting your eye exams. You'll be good.
Thank you.
Thank you, guys.
Thank you.
I love as people are about to cross the street, they're like obviously looking at me and going, let's go the other way.
Yeah.
No, thank you. Alrighty. No. Okay.
I'm terrible. I don't have any questions. I'm so sorry.
Okay.
I'm sure they do. I'm sure they do. You didn't hear that noise? Hey.
That is wild.